Great sex doesn't have to stop after having a baby, but pain with intimacy can definitely kill the mood and feel really discouraging. Research shows that approximately 43% of women are still experiencing pain with sex at 6 months postpartum. 43%. That's a lot. And the statistics are probably higher than that when we consider how many women are not sharing this with their providers, or if they're brave enough to do so, are unfortunately dismissed. Because pain with intimacy is so common postpartum, many begin to assume that that must be the new normal after having a baby. I understand this logic, but I'm here to tell you that it doesn't have to be this way, and there are solutions. In today's video, I'm going to explore the 4 most common reasons why pain with intimacy develops postpartum and share solutions that you can explore to fix it. Reason number 1, scar tissue from a pelvic floor tear or C-section incision. Scar tissue is necessary to help with wound closure. This helps to provide reinforcement to an area as it is healing to reduce any extra loading and stretching forces until that wound is fully closed. It is also highly sensitive to touch and stretch, which is another protection mechanism. After the wound has fully closed, if the tissues that were affected are not able to restore their full flexibility, pain and discomfort will persist. In the case of a pelvic floor tear, this can create pain and discomfort with initial penetration and stretch of the vaginal opening, or it can create sensitivity deeper into the vaginal canal depending on the location of the scar itself. In the case of a C-section, we can have abdominal adhesions that are stuck to the uterus itself underneath the abdominal wall. The uterus is connected to the vaginal canal, and then any type of stretch or thrusting inside of the vaginal canal can feel really uncomfortable due to the scar tissue adhesions along that C-section incision up above. So how do we fix this? Scar tissue massage is a really effective treatment style to be able to help these tissues regain their flexibility. Pelvic floor physical therapists specialize in this both for C-section incisions as well as pelvic floor tearing injuries. And this is something that we use in our treatment sessions as well as educate our patients on how to do this at home when needed. Reason number 2, vaginal dryness due to hormone changes. Estrogen serves many important roles in the body, one of which is to provide lubrication and circulatory support to the vulva, urethral, and vaginal tissues. In the early postpartum phase, as well as throughout the time of breastfeeding, the body goes into a low estrogen state. This increases the likelihood of vaginal dryness, and for some, this then increases the prevalence of pelvic pain and urinary urgency symptoms. Vaginal dryness can also develop with certain types of hormonal birth control, as well as with medications like antidepressants. Low thyroid levels and age-related changes can also be a factor. So how do we get the juices flowing again? 2 things that my patients have found to be especially helpful with this is 1, the use of topical estrogen cream or an intravaginal estrogen suppository. Both of these require a prescription, so you'll need to talk to your doctor to see if that's the right fit for you, but incorporating that along with pelvic floor physical therapy often yields really positive results. The other thing that I find helpful is getting a full blood work panel done if you haven't done so recently. This gives you a snapshot into your health right now and gives you insight into how well your thyroid and adrenal functions are going so that you can know if you need to supplement those additionally to help support your vaginal tissues. Reason number 3, pelvic floor muscle tightness. Tight pelvic floor muscles, whether it be at the vaginal opening or deeper inside around the vaginal canal, can contribute to pain with intimacy. When these muscles are too tight, it creates a decrease in flexibility of those muscles. And that is what often causes a pain with intimacy and any amount of penetration. As mentioned previously, when we have scar tissue, whether that be at the pelvic floor level or across a C-section incision, this can also contribute and lead to tightness within these pelvic floor muscles as well. So how do we restore flexibility? Know that just doing Kegels is not the solution. And often, in this way, this tightens the pelvic floor muscles even more, causing more discomfort and pain in the process. Generally speaking, when we have a tight pelvic floor, that means that we need more strength and coordination throughout your core team, meaning your hip muscles, your pelvic floor, your abdominal muscles, and your diaphragm. All 4 of those together are a coordinated system. When we have tightness in the pelvic floor, that means we need more support for that entire team to work more effectively. Connecting with a pelvic floor physical therapist is the best way to determine the specific cause of tightness in your pelvic floor and guide you towards an effective solution. Reason number 4, postpartum care ends way too soon. Most women who give birth in the US get only 1 postpartum visit at approximately 6 to 8 weeks postpartum. That's just enough time for wound closure, but not enough time for full healing. Full healing means restoring tissue strength and flexibility, which takes approximately 12 weeks at the very least. Being told you're all clear at 6 weeks postpartum when you don't feel all clear places a huge burden on you to navigate your healing and recovery on your own. So how do we make your recovery more clear? Ask your birthing provider for a referral to pelvic floor physical therapy. We specialize in postpartum recovery, so we can help guide you back to doing all of the movements that you enjoy most, including sex with your partner. So when your OB says goodbye at 6 weeks, I encourage you to say hello to a pelvic floor PT in your area. You can always reach out to us for help, whether it's been 6 weeks or 6 years or longer since you had your little. We can always help you get back to doing the things you enjoy most. I hope you found today's video to be informative and helpful. The most important thing I want you to remember is that you don't have to just deal with painful sex postpartum. There are solutions. If you feel comfortable sharing in the comments below, I'd love to know what your experience has been navigating these challenges. The more we talk about these issues, the more awareness we can spread so that more women can get the help they deserve. Thank you for watching. Be sure to like this video and subscribe to my channel, and I look forward to catching you in the next video.